Hi everyone, Dr. Leigh here from Your Vet Online, and very excited today to be talking with Dr. Joanna McLachlan. Now, Dr. Jo is the Chief Veterinarian at Pet Behaviour Vets. She has got some further training in all things behaviour, and so we're pretty excited today to be having a little chat about all things behaviour. Okay, so Jo, welcome to Ask Us Anything.
Thanks for having me.
Do you want to tell us a little bit about how your interest in behaviour vetting came about?
Well, of course, I had 2 dogs with behaviour problems a few years ago, and so that was quite interesting, quite an ordeal, and quite sad. And of course, back then I didn't know a lot about behaviour, but that sparked my interest and got me researching and going to conferences and learning whatever I could about behaviour, and the rest is history.
Oh, cool. So you actually did some further training and you did your memberships in behaviour, didn't you?
Yep, so did lots and lots of study and sat some really, really difficult and stressful exams through the Australian and New Zealand College of Veterinary Scientists, and I passed, yay! And so now I'm a member of the college, which basically just means I know a lot about that particular field.
Okay, so your practice is only behaviour problems now, isn't it? Like you're not actually doing your classical veterinary stuff.
Yeah, so we just see animals that have behaviour problems. So we generally have most of our cases referred to us by vet practices or dog trainers, and we only treat the behaviour problem if we identify that there are other health issues, and they are always sent back to their vet.
Okay, all right. So a common theme and a common question that is often asked is that it seems like behaviour problems are becoming more prevalent with our pets. Is that a real thing, or is that something that, it's just we're as a society we're more in tune with mental health now?
I think that's it, and I think that there's been a lot of debate about that, but I think it all comes down to the fact that we now know that animals have feelings, and they have the same, very similar diseases to what we have as humans. And the thing about veterinary science is we kind of lag behind human medicine by probably a few decades.
Yeah.
And so even in human medicine, we're only just recognising that mental health issues are real. And so luckily we're now not just sort of labelling dogs as just being aggressive or land sharks or naughty or whatever. We're actually looking at we're actually looking at the actual underlying reason, and a lot of the time, not always, but a lot of the time, it's because there might be some kind of anxiety disorder going on.
Yeah, cool. So Callie here's got a little question. What's that? I would like to know about panting, and I've read that it's a sign of anxiety. But why is it not
sure? Pants all the time.
Yep. Okay.
Yep.
So, I mean, panting's a big subject. That could be so many things, couldn't it?
Yeah.
It might not be anxiety.
So if it's a new problem, any new change in behaviour, you always need to go to your usual vet and have a checkup, because panting can be a symptom of many health conditions, including lung problems and heart problems and that kind of thing.
Cushing's disease.
Yeah, that's right, hormonal problems. And so, but if you keep a log and try and notice when your dog is panting more, for example, when it's also pacing or worried or hiding, or during storms, or when it's when anything is stressing the animal, then panting probably is significant, and it could be a sign that it's anxious.
That's right. So, write down when you notice it panting. Keep a little diary of it.
Diaries are great.
Yeah. With all behaviour problems, I think keeping a diary of when strange or abnormal behaviour occurs, that you'd have to say that's one of the hallmarks of trying to work out whether it's a behavioural issue or whether it's a health issue.
That's right.
Yeah.
That's right. And I usually ask most of my clients to keep a diary. Most don't, but the ones that do, it actually really does help, particularly if there's questions about what actually sets the animal off. So if we don't really know what all the triggers are, then keeping a diary so that we can look back and notice patterns, that could be really, really helpful.
Cool. So one thing, a lot of people tend to go to a dog trainer. We love dog trainers, nothing wrong with them.
I work with dog trainers.
Exactly,
they're amazing.
Exactly. Yeah. So when do you know to go to a dog trainer versus a veterinarian for a behavioural problem?
It's complicated, and even some dog trainers and some vets don't know how to tell the difference. So it can be really difficult. Put simply, if your pet has a training problem, you see a dog trainer. If your pet has a mental illness, and sometimes it's hard to know if your pet has a mental illness, so you would go and see a vet for a screening consult to have a brief chat about what the issues are that you're having. But basically, if there's any indication that there is panic involved or high anxiety or aggression, then you almost always need to see a vet who has an interest in behaviour.
Yeah.
Some trainers are really, really good at dealing with some mental illnesses, particularly the maybe not the more extreme mental illnesses, because they almost always need vet intervention. But
what's an example of an extreme?
So obsessive compulsive behaviours where they're quite extreme. For example, a dog that's spinning and cannot stop. That's not a training problem. Okay. You could train the dog to sit and not spin, but it's still going to have that urge to spin, and that is a chemical problem in the brain.
Wow.
Another example would be an extreme panic attack during a storm. We all know those dogs that chew down the door, break through glass windows. That is not a training problem. That brain has basically switched off all logical thinking and is in complete fight or flight mode. And you can't learn or remember good behaviours when you're in that state.
I think that's something really important to realise and you can always ring your vet and ask them, do you think this is behaviour versus a training issue? Because I think can be hard for people to recognise.
Yep, and if you're not sure, just call us. Our admin assistant who answers the phone, she's a dog trainer, and she will spend 10 or 20 minutes talking to you and trying to sort of work out whether you need to see one of our vets or one of our trainers. And sometimes we send you back to your vet, or if you have a trainer, we'll send you back to your usual trainer, or if it's a really difficult problem, we might send you to a behaviour specialist.
I think we're in the flight line. Here comes a loud plane.
The problem is going live, isn't it?
We might just wait. Hurry up, plane. Can everyone see the plane? Can we see the plane? Oh dear. Anyways, all right. So we've had a few questions on the page about cats that are spraying and toileting in areas outside their litter tray. Now that is a really common problem. I get asked this all the time. So is that a mental health problem, or is that a training problem?
Well, a thorough behaviour consult will help determine the difference. So, and because it's very important because the treatment is so different.
Yeah.
If it's a toileting problem, it's usually what you would loosely call a training problem. It's basically toilet training, and the cat needs to be taught to use the litter tray properly. And we look at the cat's preferences and aversions, and we try and work with the cat to work out what they like or don't like about the litter tray and why they're not using it. Whereas if it's an anxiety related problem, which might be manifest as spraying on vertical surfaces, then certainly we need to deal with that a completely different way. Anxiety is not a training problem, it is a mental problem, and we need to attack that from a different angle.
I had an interesting case where the husband had growled at the cat and the cat looked like it was taking revenge and actually went and peed on his pillow right next to his head. Now, is that a behaviour problem, or is it revenge, or is it just...
I don't think we know if animals feel the higher emotions like jealousy and revenge. I don't think we know that.
Okay.
But it certainly makes sense that if the husband made the cat anxious, then the cat's going to pee on whatever made it anxious. So that kind of makes sense to me. Yeah. And you certainly don't deal with that by punishing the cat or anything like that, because punishment has been known and proven to make anxiety worse.
Yeah, that's an interesting thing. There's a lot of people that are still very much, about punishment as a training aid. Mm-hmm. And lots of research has actually shown that's completely inappropriate now. And it's not just with animals, it's with people, children and everything like that, isn't it?
Yep.
Like we use positive reinforcement rather than punishment.
That's one aspect, definitely. So we know that all animals with a spinal cord learn the same way.
Yeah.
We learn through cause and effect and other ways. So particularly with cases that I see, because almost all of them have some kind of anxiety component, punishment has no place.
Yeah.
And we know through lots of studies, and it's very well known that punishment makes anxiety worse. It doesn't deal with the underlying issue. It makes the animal confused because it doesn't tell them what to do. It just tells them what not to do. And punishment can actually make aggression worse. So vet specialist Kirsty Sexel said the other day at a talk I went to that aggression increases by 25% if we use punishment.
Yeah.
So there are so many other methods available to change behaviour that we shouldn't be reaching for punishment first off.
Yeah, so it's often people like behaviour veterinarians and dog trainers, often the Delta dog trainers, isn't it? They use a lot of high value reward system, isn't it?
Yep. So you've probably heard of a lot of vets recommending that you see a Delta trainer. The reason why we recommend Delta trainers is because trainers who have trained through the Delta Institute only use modern positive methods. So it doesn't mean that trainers that have trained through other institutions don't. At least we just know that particular institution is very vocal about being up to date.
So we had a question that I saw that Mia Friedman actually asked on her Facebook page today, and she was wondering why her dog, who is a female spayed dog who was about 2 years old, she was wondering why she liked to hump things. So she would get excited, obviously, and then she would go and find something like a toy or something in particular, and looks like she's showing humping behaviour. Tell us a little bit about why dogs do this. I personally saw it on the weekend here. There was a Labrador who was doing what I call the Prozac run. He's doing the big hooning around, and then he started to...
Zoomies.
Yeah, the zoomies, yeah. He did that, and then he hooned over to another dog, then just started leaping on him and trying to hump him.
Yeah.
It's really common.
Very common.
Yeah,
Yep,
so...
Absolutely. So humping is not always sexual. In fact, most of the time it's not. It's usually... there are different reasons. Some dogs play that way. That's just a play style, which can be really annoying for the other dog.
Yeah.
But more often than not, it's because they're excited. They're overexcited. So, as you said before, dogs that are running around like crazy at the dog park, their adrenaline levels are so high, and the body needs to compensate for that and try and bring the excitement down. And one of the ways that the body or that dogs try and kind of release that stress is by doing that. So it can happen when you're overexcited, so kind of like good excitement, but then there's also bad excitement, which anxiety and that kind of stress as well.
Yeah.
So some dogs will mount things if they're really stressed.
Oh, okay.
So a typical example might be I don't know, you're giving one animal attention and the other dog, who has had a history of not enjoying seeing the other dog get attention, and then that dog comes and humps the dog that you're giving attention to, because that interaction is making them anxious.
Yeah. So one of the things that you can do when that happens is actually remove if your dog's the one that is the humper.
Yeah, get them off the humpy. Don't yell at your dog, don't shout. We said before, don't use punishment, because that can increase excitement levels and sometimes create aggression. So just interrupt the behaviour, maybe with a come on, come here, that kind of thing. Get your dog's attention, call them over, reward them for coming, and just give them a few seconds to just calm down. So it's not a timeout like a punishment or anything like that. It's just you're helping your dog regulate its own arousal levels or excitement levels. Maybe just get him or her to focus on you, maybe do a look or a sit or something like that. Wait till your dog looks calmer, and then, all right, go play again. It is really important that we interfere in a dog park situation with certain situations when dogs are being bullies or being annoying. It's very common for people to say, "Oh, just let them go; they'll sort themselves out."
That can turn into disasters.
Sometimes they do, but it's just like if you have your 2-year-old toddler playing in the park and they start bullying another kid. You need to step in and remove them from that situation.
Actually, that brings us to another question. I think, memory serves me right, it might have been Lynn that asked this, about she was struggling with her dog at the park. He'd been on the lead once and was attacked, and then now he really struggles and is showing aggression when other dogs come up to him when he's on the lead. Now, sorry if I've got the wrong person here, but sorry, my memory fails me.
Yep.
But anyway, it's that whole aggression when approached.
When approached on the lead.
Yeah, when your dog is on the lead.
Yep.
Now, are there any tips that we can do to help prevent that?
Yep.
Or is that something that we need to see a veterinarian who does
it all
work in
depends
behaviour?
on the context, the frequency of the behaviour and how intense it is and whether it's in context or not. So, if your dog is being hassled by another dog that's being really annoying, or if you have an old dog or a sore dog, and it's very clearly saying to the other dog, please go away, please leave me alone, it's moving away, the tail's between the legs, it's licking its lips, it's yawning, it's turning its head away. So they're all subtle signs of anxiety. Most people don't pick up on that, and they don't realise that their dog has been saying for quite a few minutes that they're uncomfortable. And then the dog realises that it's being ignored, and then it has to escalate the conversation to shouting, which is growling, biting, that kind of thing. So learn to read your dog's body language and preempt it before it happens. If it's happening a lot and your dog is really uncomfortable anytime a dog comes near it, even if the dog is not bothering it, then there's probably maybe a fear or anxiety issue there going on.
Getting very sunny here.
The clouds have finally gone away. So the point being, it depends on the context, and if you're not sure, please ask a professional. And that's the whole point of our consultations. That's why they go for so long, because we ask so many questions, we watch videos, we observe the behaviour.
Actually, taking videos of your pet when it's doing different things, that's really valuable. So even if it's just your normal regular vet to show them, I love it when people have got videos to show me. And it's so
easy. Everyone's got a mobile phone in their pocket.
Exactly.
Yeah.
Now, one thing that we often hear is that people are really scared to put their pets on medication because they're scared that the drugs that we give for mental health are going to make their animal sedated. What are your thoughts on that?
Basically, if your pet is a zombie on medications, then it's probably on the wrong medication or the wrong dose of medication, and you need to talk to the vet who prescribed it, because almost always the purpose of putting your pet on behaviour medication is not to sedate it, it's not to change its personality, it's to improve its quality of life. You should see improvements in your dog's personality, not a deterioration or a change like that, a worrying change. The point being, always stay in communication with your vet that prescribes the medication.
Yeah,
It's
and I
really
guess,
important. And then there sometimes you will get some minor side effects, and again you need to talk to your vet about it if you're worried. And it's often temporary, and they often only last a few days, maybe a week. And hopefully the vet who prescribes that medication has explained that to you. So I try and go through all of that with my clients so that they know what to expect.
And I guess the big thing too is some of these medications, your dog might not necessarily, or cat, may not necessarily need to be on them forever.
Mm-hmm.
Sometimes it's just to settle the brain, allow them to learn.
That's right.
And then we can wean them off. So it's not necessarily a lifetime treatment. Some animals, yes, it will be, but others it won't be.
Mm-hmm.
So I guess it's not, if you do have concerns and your animal is showing signs that require medication, then please talk to your vet, because they might not have to be on those drugs forever.
That's it. And the medication plan for one animal is not going to be the same as the next. We have, at Pet Behaviour Vet, we use probably about 15 or so different behaviour drugs. We have them at our disposal. So, and they're dispensed in various combinations and doses and dosing frequencies. So it's not just, I'm not going to put every animal on the same dose of Prozac. They're all they're all different.
And I guess that's the other thing. Sometimes, like, lots of people think, oh, my animal's going on drugs, it'll be fixed, and it's a really quick process. And as we know, like for things like Prozac, fluoxetine, it takes up to 6 to 8 weeks, doesn't it? So you may
make some changes.
Yes,
and then
some
it's a long
changes.
process.
Yeah. So all these sort of behaviour things, it's just like people with mental health issues. It's not an overnight fix. Although you were telling me the story about the cat spraying, and
That's
that
right.
was an overnight success.
Occasionally we get really lucky, and the behaviour problem just disappears within a few days or a couple of weeks, and that's very rare, but it can happen, and obviously the owners are very happy when that happens, especially when the cat's been spraying around the house dozens of times a day for the past 5 years or so, and then it all of a sudden just stops.
How good would that be?
And how good does the cat feel? That's the other thing. Can you imagine what it would feel like to have to show your anxiety in that way for your whole life?
So Marianne here's asked a question: what do you class as punishment, and is it just physical?
That's a really good question. A lot of people get offended when I ask them, do you punish your dog? Because they think that I'm talking about smacking and that kind of thing. But by definition, punishment is something aversive, as in something the dog or animal doesn't like. Something that you're using that's aversive, that's going to reduce a behaviour. So even just saying no to your dog can be classified as a punishment to that dog. And in the end, it's the dog or animal that decides what is punishing.
Okay, that's a good point too.
Yep.
That's
so
a really
for some
good
people,
point.
for some dogs, you just look at them and they go and hide.
Yeah.
So that was punishing for that animal.
Yeah.
And the other extreme is those, crazy, hyperactive, staffies or Labradors that are jumping all over you, and that are pulling on the lead, and then you put a check chain on them, and you're checking them, and they just keep walking because
it doesn't work.
It's not punishing enough to stop the behaviour, because the behaviour is motivated or driven by something else that's a lot more exciting than having to kind of avoid that punishment.
But then, and then we start to think, what is the damage that occurs with that punishment though? Like, so using that example, like some people...
Physical damage to their necks. And of course emotional damage. It's not nice to have to, for the person to have to continually be yelling at their dog or smacking it or something like that. So it's not very good for their relationship with the animal.
And sometimes those sorts of examples, it's not necessarily a mental health problem with the animal, it's just a training issue. So, getting a good dog trainer that can help, teach your dog to walk on a lead quietly next to you. Oh, how good would that be? You don't lose your arm out of its socket every time. But that was a great question. Thanks, Marianne. And then I guess might finish up. If you can tell us what happens in a behaviour consult, and we'll just finish up there after you've...
Yeah, so our behaviour consults basically start before we even meet you in your house. So we start researching beforehand. So we ask you to fill in a really long questionnaire. We ask you to start taking videos and send them in. We look at your pet's medical history, so we contact your vet if you want us to, and have a read through your medical history, because that's obviously really important, because we always make sure that health conditions have been ruled out or aren't contributing to the behaviour problem. And then we start making a plan before we even come into your home. So our behaviour consults are always conducted in home. We don't see you at a vet clinic. We believe that it's just my personal opinion is that I just enjoy house calls a lot more than clinic consults, because you get to see the animal in their own environment where the behaviour problems are often occurring. So we come to your house. Most initial consults are a 2.5 to 3 hour consultation, and that's pretty long, and the reason for that is we need to get to know you and your family situation and your pet's personality and observe the animal for a period of time, so that we can be able to firstly come up with the diagnosis and a treatment plan that's actually feasible, that's going to work for your situation. There's no good recommending something that is just not possible for your lifestyle. If the dog's jumping all over you, then put it outside. Well, what if you live in an apartment and there is no outside? So it is important that we come and see you in your situation, and that we take a thorough history and actually make recommendations that are gonna work for you guys. And if they don't work, that's why we have follow-ups. We have follow-ups to reassess and say what worked, what didn't work, why didn't it work, and if it didn't work, then let's make some other suggestions.
And I think the key here is that behaviour problems 9 times out of 10 are not solved overnight, and it can be months, but that's
years,
years, and it's no different than humans. Don't think that these problems are overnight. We'll get the behaviour vet and it will all be beautiful, dog's doing whatever it's supposed to be doing, the cat's behaving properly. No, it just doesn't work like that, and I think that's a really important, you have to really acknowledge that. It takes time.
It's a chronic health condition.
Yeah.
So it helps to think about a mental illness as a chronic health condition. So it might take a few months to settle the problem down to a point where everybody is comfortable and the problem's workable. So they might go into, you'd probably call it remission for a little while, and then sometimes it flares back up again. So if someone moves out, if you move houses, or if the animal gets sick, then the problem may come back. So we never talk about curing mental illnesses. It can happen, but it's rare. But generally we talk about it as a chronic long-term health condition. Yeah.
And I think there's just one more question we'll sneak you in. Kathy has asked, how do you curb food aggression
towards other dogs?
Yeah, towards other dogs.
Yeah.
Oh, that's a big question.
It's a big question.
Thanks, Kathy.
Again, it comes down to how often does it happen, how intense is the response, is it extreme aggression, or is it just kind of a little bit of growling, where the dogs are just communicating in a normal way and they're just saying, go away, this is my bone and I worked for it and I'm hungry. And more often than not, it's usually just a matter of management and acknowledging that no, your dogs do not need to eat a metre apart from each other. I don't know why people do that. They just put their dogs together to eat. Maybe it's just easier, I suppose. But it's helpful in that situation to put one dog inside, one dog outside when they're eating with the door closed or something like that, or give them space. So that often improves the situation quite a bit. If it's quite extreme, so for example, if the dogs find a scrap of food on the floor and they have a big fight over it where you have to actually intervene and separate them.
Be careful intervening in that situation.
Yeah, never use your body, never use your hands. It's best to try and interrupt them with a
big towel,
maybe a towel or a hose, or a big blanket or something like that if possible. So aggression in general usually requires a consultation
Yeah.
because there's so many different risk factors.
Especially when you know, if they're growling at other dogs, they might start to growl at you as well. And as soon
Yep.
as there's signs that they're going to attack you, then that's a major
It's more
problem
worrying.
and very worrying, especially with children around. I would definitely get some help with that one, Kathy, if that's happening.
Yep.
All right, well, it's a beautiful day here in Sydney. We've hope that's been really helpful to everyone. I'll get this put up and on the website as well, so you can check yourvetonline.com. Don't forget that Dr. Jo is from the Behaviour Vet, Pet Behaviour Vet, and I'll put her details in below as well. And hope you guys have a great day, and tune in next time when I'm not sure who I'm talking to next. We'll have to figure that one out. But anyways, thanks heaps, Jo.
Thanks for having me, Leigh.
You have a great day. I think Dr. Jo's got a few consults on this afternoon, so
There you go.
we were very lucky to squeeze her in.
Thank you.
All right then. Cheers, guys.
Bye.
See you.